Welcome to this review on healthcare systems and quality, one of the highest yield and most testable areas on the board exam. This video is brought to you by Roadmap to Residency. These questions are their own kind of puzzle. They rarely ask you to recall a disease. Instead, they ask how a good doctor responds when something in the system goes wrong, how care is measured, and how patients are handed safely from one team to the next. Our goal today is not to reteach the material. It is to show you how these stems are built and how to attack them. Make sure you are working through your question bank and a solid review resource alongside this video, because these patterns are best learned by doing many practice questions. Let us get started. Here is what we are going to cover today. First, you will learn to recognize quality metric and safety reporting stems and know exactly what each one is testing. Second, we will build the systems thinking mindset that patient safety and root cause questions reward, which is the biggest shift most test takers need. Third, we will master handoff and transition of care stems, where the safe answer is almost always structured communication. Along the way, we will walk through several practice questions together and explain why each answer choice is right or wrong. This video assumes you already have baseline knowledge from your review resources. We are here to sharpen how you take the test. Our first strategy is to name what the question is really about before you look at the choices. When a STEM describes a quality measure, sort it into one of three buckets. A structure measure is about the setup, such as staffing levels or whether the right equipment exists. A process measure is about what was actually done, such as giving aspirin on time. An outcome measure is about what happened to the patient, such as death or readmission. Naming the type usually hands you the answer. Then, when a STEM describes an error, classify it. Ask whether the mistake reached and harmed the patient or was caught as a near miss, and whether the error was giving the wrong care, delaying care, or ordering care that was never needed. Matching the exact type of error is how you avoid the generic distractor. Strategy 2 is the systems thinking mindset, and this is the single biggest shift that trips people up in this area. First, blame the system, not the person. When an error happens, the exam rewards the answer that redesigns the process, rather than the answer that punishes one tired worker. Be very suspicious of any choice that fires, blames, or writes someone up. The safer answer changes the workflow, so the same mistake cannot happen again. Second, report, disclose, and improve. These questions reward transparency and learning, so watch for choices about filing an incident report, disclosing the error honestly to the patient, and starting a structured review. When two answers both look reasonable, the stronger one is almost always the choice that reports the event and improves the system rather than hiding or minimizing it. Strategy 3 is learning the common distractor traps these questions love to plant. First, the punish the individual trap. The most emotionally satisfying wrong answer disciplines the person who made the mistake, but punishing one worker almost never prevents the next error, so favor the choice that fixes the process. Second, the skip the report trap. Some answers offer to quietly correct the problem without documenting it, but the exam wants the event captured through the reporting system, so patterns can be found, so choose the answer that reports it. Third, the wrong tool trap. Questions love to swap tools that sound alike. A root cause analysis studies an event after harm has happened, while a failure mode analysis studies a process before anything goes wrong. Match the tool to whether the harm has already occurred, and the distractor falls away. Let us work through our first practice question, and this one is built to test the systems thinking mindset. A nurse gives a patient 10 times the intended dose of a blood thinner, because 2 vials on the shelf looked almost identical. The patient is monitored closely and recovers without harm. Importantly, several nurses mention that those look-alike vials have nearly caused errors before. You are the supervising physician, and the question asks for the most appropriate next step. Notice who or what actually caused this error before you choose. Read the 4 options carefully and pick your answer. Then we will walk through the reasoning together on the next slide. Let us break this down step by step. First, spot the pattern. 2 look-alike vials were sitting side by side, and several staff say this has nearly happened before. That is a flaw in how the medication is stored, not the failing of one careless nurse. The setup itself invited the mistake. Second, apply the rule. Using the systems thinking mindset, you file a safety report so the event is captured, and then you review and redesign the storage process so those vials can no longer be confused. That is the correct answer. Third, eliminate the wrong answers. A warning in the personnel file punishes one person and fixes nothing. Taking no action ignores a hazard that is clearly going to strike again. Reassigning the nurse simply moves the risk to another unit. Each of those ignores the real cause. The correct answer is to file a safety report and review the medication storage process. Here is our second practice question, and it is all about matching the right safety tool to the situation. A patient dies after receiving the wrong medication through a chain of small failures across ordering, dispensing, and administration. Hospital leadership now wants to understand every step that allowed this specific event to occur so they can prevent it from happening again. The question asks which approach best matches that goal. The key detail here is that the harmful event has already happened, and leadership wants to trace it backward. Keep that timing in mind, pick your answer, and we will reason through it on the next slide. Let us work through this answer. First, match the tool to the timing. The key phrase is that the event has already happened, and leadership wants to trace every step that led to this specific harm. Working backward from a completed event that caused harm to find its true underlying causes is exactly what a root cause analysis does. That is why root cause analysis wins here. Now let us eliminate the others. A failure mode and effects analysis looks forward at a process before any harm occurs, so its timing is wrong for an event that already happened. An individual performance review blames people rather than studying the system. A patient satisfaction survey measures experience, not causes. The correct answer is a root cause analysis of the event. Let us talk about handoffs and transitions of care, because this is where a huge share of real-world communication errors happen, and the exam tests it heavily. First, structured handoffs prevent harm. Most errors occur when a patient moves between providers, units, or facilities. So when a STEM shows a rushed or incomplete sign-out, the safe answer is almost always a standardized, structured handoff that passes along the situation, the background, the assessment, and clear next steps, ideally with a read-back to confirm understanding. Second, own the transition of care. Discharge and transfer are high-risk moments, so watch for STEMs where medicines are never reconciled, follow-up is not arranged, or pending results are not communicated. The best answer closes that loop with clear instructions, reconciled medicines, and a confirmed plan for who follows up on what. Here is our third practice question, and it tests whether you can read a quality measure correctly. A hospital committee is tracking the percentage of heart attack patients who receive aspirin within the recommended time after they arrive. They want to know how reliably the correct care is actually being delivered. The question asks which type of quality measure this represents. Think carefully about whether they are measuring the setup, the action that was taken, or the result for the patient. Choose your answer, and we will reason through every option on the next slide. Let us break down this answer. First, focus on what was done. The committee is measuring whether a specific action, giving aspirin within the recommended time, was actually carried out. A measure of the care that was delivered is a process measure, because it captures what the team did for the patient rather than how the patient ultimately turned out. That is the answer. Now the key distinction between the wrong choices. An outcome measure would track results such as death or readmission, not whether the aspirin was given. A structure measure describes the setup, such as staffing or equipment. A satisfaction measure captures the patient experience. Each of those names the wrong category. The correct answer is a process measure. Here is a critical exam day pearl that ties this whole topic together, and it is to choose systems over individuals. When a safety or quality STEM asks what to do after an error, default to the answer that improves the system, rather than punishes a person. Answers that fire, blame, or write up an individual are almost always traps, so choose the option that studies and redesigns the process so the same error cannot recur. Alongside that, learn to trust a small set of safe verbs. Report the event, disclose it honestly to the patient, reconcile the medicines, and analyze the process. When two answers feel close, the one built on those actions is usually correct, while the one that hides the error, blames a worker, or does nothing at all is usually wrong. Anchor on those verbs, and these questions become far more predictable. That wraps up our review of healthcare systems and quality question strategy. Remember the core ideas we covered today. Name the metric type and the error before you look at the choices. Lean into the systems thinking mindset, where you fix the process instead of punishing a person, and where you report and disclose rather than hide. Match the right safety tool to the timing with root cause analysis for events that already happened. And on handoffs and transitions, choose structured communication that closes the loop. The best way to lock all of this in is to drill questions in your question bank under timed conditions and read every explanation, even on the ones you got right. Visit roadmaptoresidency.com for expert tutors and residency advisors who can help you build a personalized study plan. If you found this video helpful, please like and subscribe so you do not miss our next board review session. Good luck on your exam, and we will see you in the next video.